When you look around and see how people are behaving at this point of our restart, what are you seeing?
Well, I'm seeing that people are, for the most part, respecting and following the guidelines that were outlined for this physical distancing, the principles that we all have been sticking to in the past several weeks, and that have paid off. So we have seen that the number of cases has declined enormously in BC, and particularly in the interior. We haven't had cases that we don't know where they acquired the disease from for a number of weeks now. So that's very good news, and what has the reason why we are doing so well is because people have take the recommendations pretty seriously, and I'm confident that people are going to continue to follow those principles.
I think everyone is doing what they need to do, because it gets to a point where you have to live. You still have to live, keep going, right? Because everyone's getting so mentally upset.
I would say generally, sometimes some of the stores are a little bit cramped, but I would say overall it's pretty good.
What sort of behavior are you seeing? Are people still sticking with
I don't think so. I think there are some. I think people who have autoimmune and are more prone for illness are doing what they should, but I think a lot of people just want to get back to normal, and that's what they're doing.
People I have around me are just trying our best to still keep our distance, but we want to see each other, right? So it's hard.
If you're husband and wife, you're walking closer.
Yeah.
But if you're not, then I think it's important to have the distance.
Right.
I think that they aren't wearing the mask as much as they should.
I think they're being pretty careful. Yeah. You go to the grocery store, the lineups all over the place. Yeah. No distance. Keep your distance. Yeah. What else can you do?
Where people may be failing is perhaps seeing these the flattening of the curve, the success that we've had as perhaps interpreting it as the virus has gone away and now there is no longer any risk. And that's, I think, falling victim of the success, right? Like conveying the message that we are doing a lot better than we were, and that's true. But people may begin to think that the risk is gone, and that's not true. The risk still remains, because although we don't have, we are not seeing a lot of cases here within the interior, it takes one person coming from another province. It takes, one person that has symptoms or has very mild symptoms with the disease to get a little cluster of disease out. So, and how many people may get affected by that single case will depend on the interactions that person had. We may see a second wave, so this may be a big break, a good break that we are getting in between waves, and continue to reflect as to what can we do to to continue to stay safe, and if we need to restrict our interactions in the fall, be prepared to do that.